My name's Martin James. I'm a consultant hepatologist and HPB endoscopist from Nottingham, from Queen's Medical Centre in the UK. We're bringing colleagues from the UK who we hope will be future leaders in ERCP into a safe environment where they have an amnesty, where they can be free to ask any questions that they feel comfortable with.
I'm Dr. George Webster. I'm a consultant gastroenterologist at University College Hospital in London. This programme has covered a full range of topics relevant to the training of the attendees and their clinical practice. Particular topics include patient preparation, cannulation of selected pancreatic and biliary ducts, common clinical scenarios, stone management, stricture management, and the course itself and the model in particular is a fantastic innovation in allowing trainees to practice all the techniques of stone removal and stent placement.
I think the model is unique. It's different to anything that I've used before. For me, one of the big advantages was that the movements around the papilla were visible in a 3 or 4 dimensional model. So instead of fluoroscopy being a 2-dimensional image of the duodenoscope, this gives you the appreciation of what movements at the hand or with your body, how that interacts with the movements of the tip of the endoscope in position in the duodenum.
I really enjoyed using it. I was really impressed, and I think once you actually get to the ampulla, I think it's actually very lifelike, and it's good in terms of being able to get your positioning, get a 3D axis image and get a good idea about how you're orientated. But the highlight for me was definitely the actual practical training session, the hands-on training, particularly because the modulator was so good at emanating what is the kind of clinical scenario in terms of where the ampulla is and the use of cannulation. But I also think I benefited from meeting different clinicians from different areas, not only the trainees, which were from different areas, but also the expert panel who could give us an idea about what was happening in the UK, as well as in sort of different parts of the world.
One thing that really struck me was watching everyone else, because I think we were all from sort of different hospitals, different levels of training, and it was nice to see that, you know, I'm not the only one with finding difficulty in specific aspects of ERCP. And it was nice to talk through that with the other people and also with the trainers. And I think in a busy ERCP list, you don't often get the time to A, ask questions, and B, spend time, you know, trying to find the common bile ducts and things. So I think, those are the things that were really good.
The model that's been developed by Cook that actually gives the candidates the chance to have a real understanding of the mechanics and process of approaching the papilla, applying diagnostic techniques and therapeutic techniques in ERCP.
I think that it's very clear that they are energised by this course, both in terms of advancing their training and actually bringing back new ideas, best practice to their units as a whole. You know, I think that their trainers, who have been very supportive of them coming on this course, will gain benefit from their trainees in them having been here.